All right. Welcome in, everyone. Um, this is our kidney education group, which most of you know. That's why you're here. Um, I'm Pat. I'm one of the kidney bank social workers here, and my camera's like in all sorts of weird places. Sorry. And I'm like really flushed. I don't know why. But we are going to have the inpatient folks telling you today how this works when you come to the hospital for your transplant. So this is really important information. So please stay muted. If you're not one of the speakers, please make sure that you're muted. I will probably go through and make sure that I mute you.
Okay.
Once they're done with the presentation, Rebecca will ask for questions. And once it's open to questions, you can unmute and ask questions. Okay. All right. So I'm going to turn it over to Rebecca, and I'm going to
All
mute some
right.
people.
Okay. Hi, everyone. My name is Rebecca Grants. I am one of the inpatient transplant coordinators here. I'm going to be kind of going over with you guys some information on what to expect when you come in for transplant, some important information that's helpful to know kind of in advance. And then also joining us, we have Tracy Bodford and Lauren Franson. They are two inpatient transplant social workers who you will also meet during your hospitalization. So we'll go ahead and get started. Oopsies. Okay. So, as I just kind of talked about, we're going to be talking about, some things to know ahead of time that's going to make your transplant stay a little bit, more seamless, some helpful things for you to know. Things about what to expect, not only in the hospital, but also after discharge, and some things that you can do ahead of time to, again, make things easier. So, number one thing to know is that, when you're on the transplant wait list, you can get the call anytime. They'll give you statistics on how long people wait on average, but that doesn't mean that number is going to apply to you. There are people who get called way sooner. You can get called, middle of the night when you're at dialysis, when you're sitting down at dinner. Anytime you can get a call. So that's important to know, always kind of have that in the back of your brain. So, whenever you get the call, especially if you're coming from out of town, you're going to be scrambling. It's going to be kind of, very stressful trying to get everything together. So, it's a good idea to kind of have a bag of what you want to bring and, other things that you might need to add at the last minute, like your medications and your blood pressure cuff and other supplies that you would need while you're here. And then anything else that is in the social work packet that is given to you, they'll give you a list of things that's good to have with you when you come in. And if Tracy or Lauren, if you want to speak to caregiver preparation.
Go ahead, Lauren, that's fine.
Sure. So typically, you're going to have a primary caregiver and a backup caregiver that you're asked to identify when you meet with the social worker on the pre-transplant side of things. So the primary caregiver role is very, very important. We definitely appreciate all our caregivers that show up and are helping the patient because recovery after transplant can be difficult at times. So it's nice to have that second set of eyes, ears, hands, all those things that are really important during this time. So something to make sure of, though, when you sign up for the primary caregiver role, it's imperative you understand kind of what that means. That means that, you know, even if you have something going on in your life, like a cruise or a 50th anniversary or 30th anniversary or a birthday or a trip, that you drop those plans. As hard as that can be, when you commit to being the primary caregiver, that is essentially what we're asking, is that you are able to show up at the drop of a hat, because again, that call can come anytime and be there for the patient. Now, if it's just impossible to do that, like that's too much of a challenge, That's why we ask that a backup caregiver is identified and that backup caregiver can then step into the primary caregiver role. So, there's a little bit of wiggle room, but we do really appreciate you communicating with the pre-transplant social workers if anything changes to your caregiver plan. So whatever you work up with them, please make sure you communicate as soon as possible if for some reason you have to identify a new primary caregiver. So that way, when you come to the hospital, it's a much smoother transition and the team isn't questioning, okay, is there a caregiver or not? Is somebody here for the patient? It just makes everything easier for everyone.
Perfect. Another important step is going to be selecting and getting registered with a specialty pharmacy. So after transplant, you're going to be on a ton of new medications, and what we have you do is get established with a specialty pharmacy. And these specialty pharmacies are different from, a retail Walgreens or whatever pharmacy down the street, because they're guaranteed to always have these medications in stock, and they will be mail order pharmacies and will actually get your medications prepared for before you're discharged from the hospital, because you're going to be on so many. We can't, give you your paperwork and say, okay, go pick up your medications on the way home. We have to get everything ready to go before discharge. So part of that process is registering for a specialty pharmacy, and the pre-transplant social work team typically will give you a list of a few different options. So kind of research, make a selection, and something else that you can also do that we recommend is to call your insurance company, find out if there is a specialty pharmacy that they require you to use, because sometimes that happens. Doing this step before transplant is really helpful because we order your prescriptions very early on after transplant, because there can be I don't want to say delays, but that it takes time to process these prescriptions. So having your pharmacy selection set up, ready to go, will definitely help prevent any delays in getting your medications by the time you're discharged. Because, after kidney transplant, if everything's going well, sometimes you're only in the hospital for a few days. So that is a really good thing to do before transplant, again, to prevent those delays from happening. If you are from out of town, we do want you to bring all of your medications in the bottles, not just a week's supply in an organizer. Bring all the bottles with you. You don't necessarily have to have them in the hospital. It's okay if you leave them at, the hotel or local lodging, but it's helpful for you to have access to them after you're discharged from the hospital, because, yes, we start you on a lot of new medications, but sometimes some of your old medications from before transplant you're still going to take. Like, say it's a blood pressure medication. It's helpful if you still have access to it after you're discharged from the hospital, because if you just got it refilled at CVS or wherever, a week before, if we try to order it for you, insurance will say, no, it's too soon, we can't fill it. So for that reason, bringing all of your medication bottles with you will be a huge help. That way, if there are any medications that you're still going to take after discharge from the hospital from your old supply, you have them ready to go. And caregivers, remember, take care of yourselves as well. If you have any medications or medical equipment that you're going to need when you're staying here, again, this is mostly for the out of town folks, make sure you bring that with you as well, because you don't want to run into any situations where you left your medications or your insulin or whatever, at home 2 hours away. So make sure you kind of keep that in mind too. And kind of speaking more to that, we do ask that you bring any other medical equipment that you're going to need. So if you have a glucose meter, insulin pump, your insulin pens for that matter, CPAP machines. You are going to need a blood pressure cuff, a scale, and a thermometer. Certainly after transplant, we do have you monitoring these vital signs on a daily basis, and we have a little record sheet that we give you to record that information. So that is something that you will need as well. So again, bringing your medications, but also bringing anything else that you're going to need for your, health maintenance overall for the month or so that you're going to be staying in the area. Okay. And then if Tracy or Lauren, if you want to speak to lodging.
Go ahead, Lauren, that's fine.
All right. So if you're not from around town, as in probably within 30 minutes is usually preferred, typically the team is going to ask that you stay locally. So whether that be a hotel, whether that be a hospitality house like Gabriel House of Care, you could look into an Airbnb or VRBO. We also have a short-term rental list. We have other lodging options aside from what's listed on here. Those are things to go ahead and start thinking about, because you will have to stay locally with at least for about 30 days or more. It kind of depends on how you're doing or how the patient is doing after transplant surgery. Some people have very few to no complications, and others have some complications that requires them to have closer monitoring or maybe additional testing or additional appointments. But at least you can kind of plan for about a month is generally the rule of thumb that you'll have to stay locally.
Now, I'll just add one more thing. The requirement for kidney transplant for relocation is within 1 hour of Mayo. So you can stay within 1 hour and still be safe, but we do recommend that you stay as close as possible in the event that there are complications and you have to come back to the emergency room or, get readmitted. I mean, anything can happen. But 1 hour away is the rule. And the average stay, again, is 3 or 4 weeks, depending on how you're doing.
And we'll talk about this a little bit more later in the presentation, but it is going to be frequent follow-up at the hospital as well after discharge. You're going to be here multiple days per week. So also keeping that in mind, there can be a lot of traffic in the area, especially early in the morning. You're going to be coming in for lab work early in the morning. Maybe you have appointments in the afternoon, and then you're leaving the hospital again during that rush hour time. So you have to kind of factor that into that. Yes, maybe you're technically within the allowed distance, but just keeping that in mind if that's something that you are willing to do in terms of making that drive. Okay. You guys want to talk about this as well?
Sure. So basically some things to keep in mind as the caregiver, right? And even as the patient. If you have small children and say you have a spouse or family that can take care of them, great. But if you don't, you may want to figure that out prior to transplant. Come up with a kind of tentative plan, if you will, in the event that, hey, okay, I got the call, who's going to help watch my kids? That way you're not scrambling last minute to figure that out. Same thing with pets. If you don't have neighbors or other family or a spouse or somebody that can help take care of your pets, you may want to look into some kind of pet boarding program that could take them. Same thing with elder care, because some people take care of their parents or other older adults in their family or in their lives. Same thing there. Sometimes there's adult daycare kind of places. I think they call it elder day stay, but essentially if they meet certain criteria, they could go there, or you may have to set them up with, again, neighbors, friends, family, or maybe even hire private duty, which can be a little expensive.
All right, so now just kind of talking about what actually happens, right? So we said you can get the call anytime, have your stuff ready to go, some things that you can do to kind of prepare. So when you get that call, very exciting. Typically what they do is have you come in through registration in the ER. So have a plan for, your caregiver should be coming with you or not far behind you, 'cause to be honest, sometimes, and they prepare you for this, but sometimes you may get called in and then the transplant is canceled. So, if your caregiver, maybe they have to like fly in from somewhere far, you know, being kind of in communication with them. So when they determine the surgery is a go, you were, going in, then, that's when they need to be making arrangements to come here. But otherwise, they should be, like I said, either with you or having a plan on when they're going to be here because, once you have that transplant, the expectation is for the caregiver to be with you during the day during that hospitalist stay. So, yes, coming in through ER registration, caregiver coming with you or on the way. And then registration will need to verify your insurance coverage. It is really important that if you've had any changes in your insurance that you let registration know. And then whenever the inpatient team comes to see you to let them know as well. During your hospital stay after transplant, you're going to see a lot of people, and before transplant for that matter. You'll see when you come in, there's going to be practically a line of people out the door wanting to come see you, drawing a million tubes of blood, getting EKGs and x-rays. The doctor has to see you. The surgeon has to see you. A dietitian will see you. Social workers will see you, case management, a million people. So just to kind of, prepare for that, it's a little overwhelming at first. You meet a lot of people going into surgery, and then you meet a lot of people after surgery. The first day is kind of chaotic. If you're the patient, you're going to be tired, having some pain. If you're the caregiver, you're probably going to be sleep deprived because you were worrying all night. And then there's going to be a million people: the doctor, the surgeon, the nurse practitioners, the inpatient transplant coordinator. My team will come see you, the um, inpatient social workers, case managers, the dietitian is going to be checking on you throughout the stay. And then you might have physical therapy and occupational therapy as well. So it can be a lot for sure. If you guys want to talk about your role.
I can do that, Lauren. So either Lauren or myself will meet with you in the hospital and we will go the first time we see you, we will talk about, try to identify who your caregivers are, making sure you have a pharmacy chosen. If not, we'll assist, making sure you have lodging, again, within 1 hour of Mayo, check on your finances. And we also assist with family medical leave forms, critical illness forms, disability forms. But the big piece of that is if you want those done while you're in the hospital, which average stay for a kidney is about 3 or 4 days, you need to get those to us as soon as possible. That way we can work on getting them done before you're discharged. If it's day of discharge, you still haven't gotten us the forms, then they'll need to go to your post-transplant coordinator for completion. And we also check to see how you're coping because, again, things can get challenging. So we always want to make sure that everyone's getting enough rest, the caregivers, eating, sleeping, trying to take care of themselves too. It's stressful for everyone.
Yeah.
Yeah, I want to add to that as well, real quick. So going back to the FMLA, something else to keep in mind, typically only certain family members are covered, right? So spouses, children that are above 18 years or older, or your parents, basically. Unfortunately, typically siblings are not covered. Now, that's something that that's federally, but sometimes employers will work with you. I've had this happen a few times where they accepted FMLA for a sibling. So sometimes it is employer specific. You could always talk to them beforehand. I would, especially if you were thinking that your primary caregiver might be your sibling. If they are working and there's a concern about, finances or anything like that, I would have them talk to their employer as soon as possible about what does that look like? Can I take FMLA for my sibling? Other thing to keep in mind, if you have a caregiver or are going to identify a caregiver that is working, I would encourage them to start stocking up on their PTO, because if they're going to experience a loss of income that is detrimental to be your caregiver for that 3 to 4 week time period, typically with FMLA is not paid. you have to take your PTO if you have it with it in order to continue pay. So go ahead and start stockpiling it as much as you can just to be prepared, or, you know, however much your job will let you keep on hand.
Thanks.
I can talk about this. So again, a big part of what Lauren and I do in the hospital is check on, we spend a lot of time checking on the caregiver. Again, the patient's receiving care, we want to make sure the caregiver is okay. And in situations where it's a difficult surgery, longer length of stay, we also offer a caregiver support group that meets on Thursdays at 11, and we can send you a link to the group or give you a flyer so that you can log into that. That's for extra support beyond what Lauren and I do.
All right, so I'll tell you a little bit about my role, or my team really. There's 3 of us on the inpatient transplant coordinator team, and we will meet with you during your hospitalization, and we'll do very extensive education with both you and your caregiver. Typically, we meet with you as early as the first day after you're transplanted. The first business day. So if you're transplanted over the weekend, we'll come see you on Monday morning. But, other than that, if you're transplanted during the week, typically you can expect to see us that next day. We will do a ton of education with you. We'll go over a lot about your new medication regimen. We'll give you a binder. I was telling you a little bit earlier about, recording sheet for your vital signs. You're going to record your medications in that binder. We'll go over more in-depth information with you on what you can expect in terms of your follow-up after discharge from the hospital. We'll go over activity precautions, infection prevention, dietary precautions, a lot of information for sure. And then whenever you are discharged from the hospital, we see you then as well. We're going to be the ones that bring you all of your medications. We order all of your prescriptions, bring them to you when you're being discharged, bring you your medication instructions, and go through everything kind of a second time. So, um, we're kind of there to help that transition from being in the hospital and having, the nursing staff take care of things for the most part, to all of a sudden you're out of the hospital and you have all these medications and you're doing it on your own. It can be very overwhelming, and we're there to kind of ease that transition and make it a little bit easier, and help you feel more comfortable with things. And part of that is, all of the education that we do. We'll give you a lot of resources. Important to know that if you're a caregiver, it is important that you are there at the hospital during the day for education, slash that you're just flexible in general, right? If there's something that comes up, like maybe you need to run to the post office, or if a friend wants to meet you for lunch or whatever, make sure that the staff knows that you're leaving. But if we ask you to be here to schedule education, it's important that you are available to be here for that education. It's important that we start it early, because if we come meet you for the first time on day of discharge with all of this information and medications that you've never seen before, it's extremely overwhelming. So that's why we start the education early, and we ask you to be there during the day, not just for our teaching, but also for the purpose of seeing the doctors when they come around. Meeting with the dietitian, they'll do like a food safety teach with you, meeting with the inpatient social work team, and then just kind of seeing the day to day. We want you there when they're doing medications, so you can see, okay, what's he taking, recording medications in the binder, and kind of getting familiar with, the overall care. We have a staff of transplant pharmacists and transplant dietitians who will be involved in your care as well. Transplant pharmacists participate in kidney transplant rounds with the doctors. They'll give insight to your medication regimen. They will advise on interactions, medication side effects. They basically do daily reviews of all of the medications that you're on. And then the dietitians will see you as well. Like I said, they'll give a teach with you on food safety after transplant, as well as just kind of assessing overall, are you meeting your caloric needs within reason? Sometimes your appetite can be a little slow after a big surgery. So they're there to kind of make sure, are you meeting your nutritional requirements? Do you need some extra protein shakes? Are you having any vitamin deficiencies, that sort of a thing that need to be addressed. Um, we were kind of talking about this a little bit before, but when you're discharged, one of the inpatient transplant coordinators will come see you on discharge day. We'll bring you a big bag of all of your medications, your medication instructions, go over a whole bunch of stuff with you. It's important to ask all the questions that you have. You can never have too many questions. Because, like I said before, when you are discharged from the hospital, you'll be at home doing these medications on your own. So, the best time to get clarification or ask for extra assistance is while you are still in the hospital so that we can make sure that you feel comfortable. We never want you to feel like you have to figure anything out on your own. That's what we are here for. Kind of going back to the lodging, making sure that is set up by discharge day. Um, Another reason why it's important to, be at the hospital so that you're aware of, okay, when is discharge coming up? So you have time to, go get whatever groceries you need, make sure that the house is clean and ready to go. After discharge, you can expect to come back sometimes the next day. Your follow up is going to start pretty much as soon as you discharge from the hospital. It's going to be multiple days a week, multiple appointments in a day, and there can be big gaps in your schedule where maybe you have labs in the morning and then you don't have your next appointment until the afternoon. Um, so it can be a lot. It's quite busy. Just expect to be at the hospital a lot after discharge. Um, you know, at least 3 days a week at first, the first couple weeks, and then it typically gets a little bit less after that. After the month of clinic follow up is up, they'll let you know if you're good to go back home. If you're from out of the area, and at that point, the follow up will be a lot more reasonable. You'll just get labs done, and you would be able to get them done at your preferred local facility if you're from outside of the area. Um, More like, once a week for a little while. So it's a lot at first, and we just ask you to kind of bear with us, be flexible um and just kind of be prepared for that. Again, going back to if you are from, an hour away, maybe that's allowed, but just know that you're going to
Mhm.
be driving back and forth quite a bit. Um, for the month and even beyond that, as the patient, you can't drive until the transplant team clears you to do so, at least for the month that you're under that, close clinic supervision. So the caregiver expectation is that the caregiver transports you to all your appointments, but not only that, the caregiver needs to attend the appointments with
Mhm.
you. They can't just drop you off and pick you up when you're done. Um, because when you come in for these appointments, it's a lot of information still, even after discharge, once things are kind of, stabilized, you're over that initial hump of, recovering from the major surgery. You're going to go to these follow up visits multiple days a week, and they're still going to be giving you a lot of information. They're going to be adjusting medications. You might have different follow up, different types of doctors that you might need to see. Um, and it's important to have someone else with you just as an extra set of ears and an extra voice that can help advocate, ask questions that maybe you don't think to ask. um, So that will be very important as well. And, it's been kind of shown that if you don't have great caregiver support, your outcomes might not be as good as they would be if you do have that very important caregiver support. Being a caregiver is a very important role. We have cats. So that pretty much wraps it up. So we can open it to questions. If you can type it in the chat or you want to unmute and ask questions, let us know if there's anything we covered you have questions about or anything that we didn't cover that you're wondering about.
I have a question.
Sure.
I'm doing PD at home twice a day.
Mhm.
I guess I would need to bring all that equipment with me.
You can bring it, but you typically will not need it while you're
Okay.
in the hospital. But in the event that, there's some sort of delay and
That's what I
maybe
was
you're not
thinking.
going home right away, go ahead
Mhm.
and bring it with you. It's better to have something and not need it than to need it and not have it and be scrambling. So if you're unsure, just bring it. But I can say historically for PD, you're probably not going to need it. But I don't want to tell you not to bring it and then something
Mhm.
happens.
Okay, all right, thank you.
Yeah, of course. Anything else?
So just as an aside here, Tracy's now added another cat to her home. So there's now a
She
little black
did.
kitty cat
Yeah,
who
we'll have to
adopted
update
her.
it.
Yeah, adopted
Yeah.
her during the last freeze.
I have a
Yeah, this is
question.
Bart and Gracie.
Go ahead.
Yes, ma'am. On the social package, the package with the blood pressure and the scales and stuff, can you
Mhm.
email me that package again? For some reason, I can't find it. You
Yeah,
know what I'm talking?
yeah. Can you send it to just me in the chat what your name is?
Yes, ma'am.
Just in the chat, just to me. And I'll get
Okay.
that off to you.
Okay, thank you.
Okay.
I have a quick question.
Yeah.
On the short-term rentals, is that like VRBO houses or is that like hotels?
So it is, it's actually apartments. There are some apartments here.
Okay.
And there are some condos, I think, that are included there. So they're on that accommodation guide that we give you during your initial appointment here.
Okay, that's right. Okay. right.
Okay.
Thank you.
Okay.
Hello, can you hear me?
Yes.
Yeah.
Okay, I'm Carmel. It's my husband. He's sitting behind the laptop listening. We're wondering if we're from out of town when we get that call, how much, what's the time limit for us to travel over there? Because we would have to book the air flight to get over
Yeah.
there.
That's a good question. It really depends. It depends on where you're located. It depends on the case itself. Sometimes it's more time sensitive than others. Important thing to know is that when you do get that call, they will verify where are you coming from, how long is it going to take you to get to Mayo, um, and they will give you a time on when you would need to be here. So that is something that is kind of determined at the time. But it's great that you're thinking about that now, because being on time will be important because some of these cases are time sensitive. And like I was kind of saying before, there's a lot of workup that needs to happen before you even go into the OR. A lot of people that need to meet with you and last minute testing and everything. So it is important that when they do give you that call and give you a time to be here, that you get here by that time.
Okay, all right,
Yeah.
thank you.
You're welcome.
Excuse me, I have a question.
Sure.
I was just wondering, you probably sent this it's been a while since my initial visit. Is there a list of things that you should bring?
Yes, we give you a list. I'm going to see if it'll let me put it in the chat here. I don't know if it'll let me or not. But we give you in that initial social work packet, a list of what to pack and bring with you.
Okay, and like I said, I'm sure I have it somewhere, but I just
Yeah.
don't have my fingers on it this second.
So how do I go in the chat to email mine? Is this coming up the pink, the email my email?
Actually, you go in that, do you see the chat down at the bottom
Where it's
of your
got your
screen?
name?
Do you see where it says chat?
Oh, mine don't have chat at the bottom.
Oh, another thing you can do is send me a portal message because you registered to this through the portal message. You
Mm-hmm.
can just send me a portal message and I'll send it to you through the portal.
Oh, okay then. All right.
Okay.
Thank you.
I
All
have,
right. Go ahead.
I mean, what about if I live about 45 minutes from Mayo? So do I have to worry about to get a place any closer or just don't worry about it?
I can answer that. You should be allowed to return home if you're within 45 minutes.
Oh,
So like Rebecca was saying, just be aware you're going to be here pretty frequent. If you want to get something closer, fine. But most of the time, if you're 45 minutes away, you'll be able to go home with no problem.
okay.
I have a question. Do you have to take any meds prior to the operation for rejection purposes?
Typically, the anti-rejection medications start when you're actually in the operating room. They'll give it all through the IV when you're under anesthesia, and then all of the anti-rejection pills start after transplant.
I have a question. My husband just asked a question a few minutes ago about the short-term rentals, and you said there was a list that we should have received. I don't believe we received that list. Is there any way you can email that to us through the portal?
Yeah, can you send me a message through the portal and just ask for that list? Ask for
Okay.
the accommodation guide and I'll send it to you.
Okay. Yes, sure. Thank you.
Okay.
Hello, that's for Edward, my husband. We haven't received any list of accommodations, so I will message you on the portal as well.
Okay. And I put the packing list out there for everyone, and I'm going to go ahead and
Okay.
see if I can find the accommodation guide. I'll put it out there in the chat. But sometimes it's hard for you to print from the chat. So if it's easier to get it through the portal, just shoot me a message and I'll send it through the portal. Okay.
Okay, thank
And,
you.
and
Oh,
remember,
I got it already.
And remember, Lauren and I will also we'll give you the accommodation guide again, but we'll also give you, if you need it, a short-term rental guide that's separate from the accommodation guide that's got some furnished apartments, houses, a little bit of everything on that list. And so those are two separate lists. But again, don't worry about having it right now. We will give it to you again when you come in for your surgery.
Okay, all right, thank you.
Is there a dollar amount per day that's kind of an estimate for the area? For the for the lodging?
So Gabriel House,
depends.
yeah, it depends. So Gabriel House is probably the cheapest thing here, and that's $55 for the first night, $40 every night after. They only have 29 rooms, so it's very difficult to get in there. I think around here, we see kind of on average about $125 to $150 a night. Do say that you want a Mayo Clinic discount and ask for a longer term discount if you're going to be here for 3 or 4 weeks. Okay.
Okay.
But things change here. And yeah, when we have a TPC, sorry.
Okay, I'm
Yeah,
so
when
sorry.
we have
What's
that-
the distance between Gabriel's house to the Mayo Clinic?
about 5 blocks.
5 blocks.
That's
And they
close.
run a shuttle. They run a shuttle between the house and the
Oh, they
and the
do?
clinic. Yeah, they
Oh,
do.
They have a shuttle. Okay, okay, great.
And it's usually easy to get a place to stay.
Depends on the time of year. sometimes there's some events going on in town. So, for instance, I think there's a golf tournament coming up. That's when things can get difficult to find. But typically, I think everyone's always found something before they leave the
Okay.
hospital because we usually don't let you leave unless you can find
Okay.
something because we don't want to just kick you to the curb,
Okay.
That's not the
Yeah.
goal.
Okay. Thank you. And with the Gabriel House, you guys probably already know, but you can't reserve ahead of time. So, you get the call for surgery, you come in, you can't reserve the room until the patient's actually gone to the OR. You can call them and give them kind of a heads up that you're coming, but they will not reserve a room until the surgery actually happens in case of a dry run.
That's right.
I know you guys have more questions than this. These are the folks to ask because you don't get to see these folks until you actually get here. So we like you to be able to ask them your questions before you have to come in.
I called my insurance. I thought they'd take care of Gabriel House, but Florida Blue said they gave me an option of some more insurance, some other places to stay closer. So I need to find out what the distance is on my insurance from where, place to stay. So I don't want it too far. I want to be right down.
Yeah.
Yeah,
I have
so
a question regarding the board, the medical board. How often do they meet?
The selection committee here meets every week. They meet on every Tuesday. So generally what I tell people is if you've finished all your testing and you haven't heard from your nurse coordinator within 2 weeks, reach out to your nurse coordinator and say, do I need to do something else? Is there something else hanging out there?
We got a question in the chat. How soon do you know if you still have to do dialysis after transplant? That's a great question. And this is something they'll kind of give you a heads up with not only when you're being evaluated for transplant, but also when you get that call and you come in. You can have what they call a sleepy kidney, where it takes a little bit to fully kick in and do its job properly. So sometimes you might need some extra dialysis. Sometimes you don't need it at all. Sometimes you may just need it once or twice. Other times you may get it on a regular basis for a few weeks after transplant. Now, the timeline on how soon they would know that, sometimes they know right away. They say, oh, your potassium's going crazy. We got to give you a quick dialysis. We got to get this fixed up. Other times, it's a few days and kidney's kind of working and, it's kind of doing its job, but then they're like, oh, let's do some dialysis. Let's give it a little boost. And sometimes that can happen, up to a week after transplant. So it really
So,
just depends on you, depends on the kidney.
so in other words, I need to bring my machine and some dialysis.
So after dialysis, if you're on PD,
I'm
after
on PD.
yes, after the transplant, if there's any need for dialysis for a sleepy kidney, they do hemodialysis.
Okay, so you
And
think if I bring a case of each, I have enough, or bring more than one case? Well, more than, come on, different kinds.
mhm. Yeah,
So,
like I was saying before, you can bring that equipment with you just in case if there would be some sort of delay in the surgery, but you're not going straight back home. Like if you're in doubt, just bring it with you. But um, I can say almost certainly you're not going to need your PD equipment because, if you get the transplant, like I said, if you do have that sleepy kidney and they have to do some dialysis, they would do hemodialysis instead of the PD. So, yeah.
okay.
And they do it in our dialysis unit in the hospital. The other thing
Yeah.
to think about is they're not going to keep you in the hospital if your kidney is not working. They'll go ahead and discharge you and then set you up with our local dialysis center here on campus to keep doing your dialysis. And you'll be coming to what's called the delayed graft function clinic, where you're pretty much checking in with the clinic folks every day or every other day and doing dialysis. until the kidney starts to wake up.
Until it wake up, okay.
Right.
I think I feel comfortable by bringing my equipment and my dials, just in case.
Yeah, certainly.
I feel better.
Yeah. In the event of rejection, can you be eligible for another transplant? Also, are we still eligible to be a donor in the future? Great questions. So, if there is rejection, that does not prevent you from getting a transplant in the future, but it would just depend on you as the patient. What complications have you had overall? So, that alone would not prevent you from getting another transplant. Depends. It's very multifactorial, but that's not something they say, oh, they had rejection, they can't get another one. We have patients quite frequently who have had transplants in the past that ended up rejecting and they get a second transplant or third or whatever. And are you
So
still eligible to be a donor in the future? As far as I know, you sign up to, be an organ donor, and you know, they will use whatever organs that are usable.
I will say one thing about the rejection. If you rejected the organ because of non-compliance, if you're not doing what the team's asked you to do and taking the medication and all that, you will have a much harder time getting a second transplant
Yeah.
because the team isn't going to want to take that chance again. And
Yeah.
probably no other transplant center is going to want to take that chance again. So it's really important that you do all that you can to make sure that you follow the instructions from the team and keep that organ. Sometimes it happens even if you've done everything that you should have done. So
Yeah, that's a great point.
I think I done asked all the questions.
Yeah.
I gotta go to the portal to get my social package. So I'm gonna do that when I get offline.
Yeah. And it's possible you'll think of more questions as soon as you hang up the
Hang
chat.
up.
And that
That's
always
what happened.
works. So
Every time I hang up, that's what
every
happened.
time, yes. So write down your questions and then,
I brought my pencil and paper, so I will have more.
yeah, if you think of anything else, write down your questions. And anytime, you meet with a team, bring a notebook with you, bring your questions, write down what they say. And then, you're going to meet the inpatient team when you come in for transplant. And same thing, we'll tell you the same thing. If you have questions, write them down and make sure that we get you prepared as best as we can.
Okay. Thank you for everything.
Absolutely.
yeah, I
Anyone
really
else?
appreciate these guys coming on.
Now, I
and telling
appreciate
me.
y'all helping me.
Yeah, this is the big
Absolutely.
stuff. I will tell you one more thing too. When you get to the hospital, there's a lot going on and they're all coming at you at the same time. But stop
I'll
and
be
take a deep breath and say to yourself, this is what I've waited for.
amen.
So
Yes.
yeah.
Yes.
So take the breath and enjoy it
I
and
will. I
and turn it
will.
over to the team. They're here for
Yeah.
you.
I will. I will do that. I'll be so happy.
Oh.
Thank you very
Okay.
much.
Thank you.
Thank you guys.
course.
Everybody have a
Y'all
good
have,
month. We'll see you next month. Okay.
okay. Y'all have a
Bye.
nice one. Bye-bye.
You
Bye.
as well. Bye, everyone.
Bye-bye.
Bye guys. Thank you.
Yeah,
Thank you.
of course. Thank you.
Thank you.